Female genital mutilation, or FGM, is a custom that has been practiced in communities for at least 2,000 years. This practice tends to be perpetrated by female family members, people who have the best interests of the girls and women at heart. These family members partially or totally remove the external female genitalia for supposed cultural, religious, or non-medical reasons, in usually non-sterile, non-medical, crude conditions. FGM is also known as female circumcision, cutting, and sunnah, and is most commonly performed upon females in infancy, childhood, and adolescence. It is also performed post-childbirth. It inflicts severe physical and psychological damage which can last a lifetime. FGM is performed due to inherent customary practices. It is important for many reasons, i.e. social acceptance, custom, religion, preserving tradition, preserving virginity, cleanliness, protecting family honour. Therefore, all of these reasons are based on lack of awareness and misunderstanding. Another known reason for certain types of FGM, especially in relation to marriage, is that it increases sexual pleasure for the male. So how can we assure these women that the advice and support offered is in their best interest? An approach that is non-judgmental and sensitive is an initial step to help the support of victims of FGM, which affects around an estimated 137,000 women in the UK. In my experience, I have found that women are keen to share their feelings. They now have a platform to voice their own concerns surrounding FGM. Traditionally, FGM is not something that is discussed in their communities. Having been robbed of their true innate female uniqueness, giving these women a voice empowers them. Listening to the women's stories gives them a platform to express their thoughts and views with no finger pointing and no blame being asserted. Another arm of support offered to these women is counselling. Since FGM became illegal in the UK in 1985 under the Female Genital Mutilation Act, and now since replaced by the Female Genital Mutilation Act 2003, we have to make these women aware that FGM is an illegal practice, and legislation is now extended to include anyone taking a girl or woman outside of the UK to perform FGM. FGM can have a debilitating impact on a woman's health, both physical and psychological. Throughout her lifetime, she can suffer from hemorrhages, severe pain and shock, urine retention, infection including tetanus and HIV, fistulas, fracture or dislocation to limbs as a result of restraint, dysuria, and chronic UTIs, which can ultimately lead to renal failure, acute and chronic pelvic infections leading to infertility, difficulties when menstruating, dyspareunia and/or sexual dysfunction, flashbacks, intrapartum complications, and chronic scar formations. It is imperative that the women are not made to feel that they are being blamed for what has been inflicted on them. Since April 2014, professionals are required to record all FGM cases. Part of that process is to carry out a risk assessment and make necessary referrals. The hope is that lifestyles for these women and future generations will be protected, improved and supported by multidisciplinary teams. FGM sits under the umbrella of domestic violence, along with honour-based violence, forced marriage and child sexual exploitation, known as CSE. It is important that domestic violence is not thought of as just physical violence. It also encapsulates domestic abuse, which can be physical, emotional, sexual or financial. Honour-based violence, or HBV, is a crime and describes the acts of controlled behaviour within families or in a community setting. There is the perception that cultural and religious beliefs or honour, or izzat, are to be protected. It is important to clearly identify the difference between an arranged marriage and a forced marriage. An arranged marriage gives the couple choice whether they agree to the partnership, whereas a forced marriage does not have to gain consent from either spouse. This is an abuse of human rights, and a person found guilty of this crime can face a prison sentence of up to 7 years. There are warning signs that can indicate honour-based violence and forced marriage, which can include eating disorders, poor performance or attendance at work, attempted suicide, being banned from working, depression, self-harm and substance misuse. As midwives, we're here to support you, and the only way we can do that is if you allow us in. So please help us to help you.